Dr. Dermarkarian is the latest addition to our oculofacial surgery group here at Duke. We're very lucky to have him. He just finished his fellowship in Southern California with Jeremiah Tao. He's a Dookie at heart, though. He went to Duke undergrad, and we're happy to have him here. So, great.
Thank you so much for having me. I really appreciate it. One of the things I want to talk about today is blepharospasm in the setting of ptosis. And someone brought up something earlier, which I think is maybe an adjunct to this, is when you have an eyelid disorder like blepharospasm, you can have associated eyelid disorders. And one of the most common eyelid disorders that you can see with blepharospasm that is related to blepharospasm. When you talk about ptosis, what you're talking about is a drooping of the eyelid. And you can have drooping of the eyelid for many, many, many reasons. But what we see is in patients with blepharospasm, they might have a higher rate of droopiness. And I'm going to go into that in a sec. But when we talk about droopiness, we're talking, it's a very common very common condition. You can see about, 10% of patients over the age of 50 have some level of droopiness. And why does that happen? There's really three major muscles in your eyelid and in your face that control opening the eye. The most common one that is the most powerful that we've talked about already today is the levator. And why the levator is so important is because that's the workhorse of the eyelid. That's really lifting the eyelid. And that's why it's really important that you don't accidentally paralyze it with Botox. But there are two other muscles that are involved with droopiness of the eyelid. One is on the back side of the eyelid, which I'm going to show you in a picture, and that is called Mueller's muscle. And one is the actual forehead itself, which is the frontalis muscle. Each one of those muscles works in a different way, and each one of those muscles is involved with the brain with a different pathway. So just because one muscle may be affected, the other two may not. And realistically, you can fix all of these muscles in separate surgeries. And so that's why it's important to know about all three muscles. So this is a diagram just to kind of show you a little bit of the anatomy, and maybe this will make more sense why injections are so important and where you place the injections. So on the diagram on the left, I don't have a pointer, I apologize. So the diagram here, this is your eyelid. And what you're looking at is like a cross-section of your eyelid. On the back side of your eyelid, right underneath your eyebrow, that is the levator muscle. It sinks right back into the area right next to your bone. That is the workhorse of the eyelid. But as the levator muscle ends, and you can see it ends right here, it gets like a fibrous attachment. It's like a white fibrous attachment. I'm going to show you some videos so you can see what I'm talking about. And that connects to the eyelid. So that underneath that fibrous attachment is a second muscle, which is this purple picture, and that is called Mueller's muscle. So on the front side of your eyelid, you have levator, and on the back side of your eyelid, you have Mueller's. Okay, levator is the workhorse. Mueller's is like an adjunct muscle that helps lift the eyelid. They call it like the fight or flight response. When you get very nervous or excited, that's why your eyes open. It's due to that muscle. And then the other picture is showing you the frontalis muscle. So that's that big muscle in the middle of your forehead. And so when you lift your eyebrows, you are activating frontalis muscle. And that's another way that people lift their eyelids. So it's all three muscles working together at any one time to lift your eyelids. And so we can do things to lift all of those or strengthen all of those to help you open your eyes more. Now, you may say, well, what's the relationship between blepharospasm and ptosis? Well, there's a lot of papers and research out there, and this is one of our famous oculoplastic surgeons who recently passed away. But his name is Rick Anderson, and he really proved that every time you guys spasm, every time you have a contraction, you are weakening the connections between that fibrous attachment and the muscle inside your eyelid. So all this movement is causing that connection to really start to get strengthened, to really get pulled away. And those fibrous attachments really become weaker. So it's harder for everyone to open their eyes when that fibrous attachment really starts to what we call dehiss or get weaker. And so that's why you see a little bit more ptosis in people who have blepharospasm. So there's a recent study, actually, this was done in 2023, and I found this paper. And so they looked at, with special video photography and looking at all these measurements, that out of 102 eyelids, out of 51 patients who had blepharospasm, 80% had some level of droopiness of their eyes. All right, so there is a strong correlation. The exact number isn't known, but it is there in some form or fashion. And so quickly to touch upon what was brought up earlier, this is a video of apraxia of eyelid opening. Someone mentioned that in the context of Parkinson's. I do have a lot of patients with this connection between Parkinson's and apraxia. In reality, I consider this in the same group of ptosis for the sake of this talk. And the reason is because you have trouble opening your eyes. Okay, this is a little bit different of a mechanism, but in reality, in the whole context of what we're talking about, this is a droopy eyelid. And so I show you this only to kind of give you an idea of what this disease looks like. And this is a posted video online. This is not my own video. But this woman, you can see, she is really trying to open her eyes. She is lifting her eyebrows. She is trying everything she can to open her eyes, but she cannot. And that is because she has a spasm of the muscle that is controlling closure of the eyes that she cannot overcome, and that is the dystonia that everyone is talking about, and that is called apraxia. And so some of the things we're going to talk about today can also help with that, and so that's why I bring it up in this talk. All right, and so moving forward here, there are a lot of papers out there. I'm not going to go into all of them, but there are a lot of things that show people who have blepharospasm, who have a level of ptosis, there are ways that you can help them get over this, not only the droopiness, but this apraxia. And this apraxia can be adjuncted with certain surgeries. So A, you have a better quality of life. B, you decrease the amount of toxin that you need to open the eyes. And that's really what the research is showing. And so these are two of the papers that I brought up. One is a paper that we recently wrote maybe 3-4 years ago that shows eyelid surgery helps decrease the amount of Botox you need. When I say Botox, I'm talking Xeomin. Thank you, Mers. And then the second surgery is talking about a new technique that I'm going to go about in the videos. All right, so these videos, I shortened them up. These are from one of my old mentors, Richard Allen. All of these videos, if you guys are interested, could be found online. University of Iowa has all of his videos. What I want to do is I want to show you how the surgeries work. Basically, what I'm showing you is how we fix the eyelid. So when you come into clinic and if you have a level of ptosis, these are the options that may be available to you. You have to tailor them to the patient and what they present with, but this is just going to kind of give you a mental picture of what we do. So this is the classic tried and true method. This is called an external levator advancement. The surgery takes much longer than what the video shows you, but basically you cut a little bit of skin on the upper eyelid, and what I want to show you is, do you guys remember that I talked about this fibrous attachment? Do you see that white line right here? That is the white line that we have to find that connects to the muscle, and then you basically strengthen the muscle by making that connection tighter, okay? So that whole procedure is just about tightening the muscle, and that white line that you see tightening right now, that's connected to the levator muscle. And by tightening that connection, the patient is able to open their eyes more. Downsides to this surgery is you have to be awake, all right, because we need your cooperation during the surgery. So some people don't love that, and I'm with you, all right? It's hard for me to have you be like opening your eyes and working with me during the surgery, but that's how that surgery works, okay? So that's the classic tried and true method. Still very popular, but we've gotten better over time. And so now for this surgery, we can put you to sleep. And so that's a big plus for patients. But this surgery is called the Mueller's muscle resection, okay? And now with this surgery, we are actually targeting not the levator, which is the muscle I was telling you about, which everyone's afraid about when you give Botox, but the muscle behind it on the back side of the eyelid, Mueller's muscle, okay? This has limitations. It's not as strong as the levator, but you can go to sleep, and we have great results with this. And realistically, what I'm showing you here is that we flip the eyelid over, this patient's asleep, and you see there's a line right here that you are grabbing, which is Mueller's muscle, which is right there. You grab it with this special clamp, and then you basically cut off that muscle to strengthen it, and then you suture it back together. So it's a very similar approach to the front side, but it's just a different way of doing it, and you do it on the back side. So there you go. You cut off the back side of the muscle here. Yes, very exciting. I wanted my talk to be the most popular, and I think I'm succeeding. All right, so when you cut on the back side of the eyelid, you are strengthening the connection between Mueller's and the actual connection point to the eyelid. So that's why it's stronger. very, very quick surgery, very good recovery time. People are really happy about this, but that's an option. The third surgery, which is actually very important in apraxia of eyelid opening, is a frontalis sling. All right, conceptually, I want to explain it like this. If you have apraxia of eyelid opening, or if you have really bad ptosis, you are using every muscle that you can to lift the eyelid. And sometimes your muscle is so weak or not usable in the eyelid, you have to use the forehead muscle because the forehead muscle is really strong. But how do you connect the forehead muscle to the eyelid? Well, we actually use a piece of plastic. Okay, so we use a sling. That's why the name is Frontalis sling. So we actually run a piece of plastic from the eyelid, or yes, silicone is what is being said in the outline, but trying to keep this, silicone plastic. All right, so we run a piece of silicone from the eyelid into the eyebrow. And then when you lift your eyebrow, you are actually lifting the eyelid with that piece of silicone. So your eyes are opening up when you lift with your eyebrow. And so really, I'll just show you this video real fast. Again, you have to find the connection point in the eyelid, this is what you're showing on this video. And then once you find the connection point to suture that piece of silicone, you can see it right here, all right? You just basically suture it into place, and then you tunnel it underneath the skin, okay? I can skip this if it's too graphic, but. So here, you are tunneling it underneath the skin, all right? And so what you are doing here is you are allowing that muscle to now be connected to the eyelid, okay? And so every time now you're gonna see when he ties this, you see how the eyelid goes up? All right, and that's because you've created a new connection point between the eyelid and the forehead, all right? I'm not sure if I should go to the last video. I'm watching the crowd. All right, I feel like people are excited, so I'm gonna keep going. All right, this is the newest technique that has come out in the last 3 to 4 years. This is called a frontalis flap, all right? When you think about surgeries, you like to use people's own tissue. If you put something into the eye, like a silicone sling, there's always a risk that you are going to have an infection, that you may have a problem with that piece of material that's in the eye. It may get loose. So what people have really tried to push over the last 5 to 10 years in terms of perfecting this technique and actually making it popular, and it's very popular in children, is we actually borrow the frontalis muscle. We find that muscle on the inside and we actually connect it to the eyelid directly. We didn't used to do that because we couldn't really figure out a good way to make it work, but now over the course of the last few years, we've really started to perfect it. So this is the newest thing. This is from one of our colleagues up in Michigan. His name is Alon Kahana, and he's a really big user of this, and he sent me this video. But realistically, I'm just gonna jump to the middle of the video here just to kind of show you the difference. At this point, what he is doing is he is tying the eyelid to the eyebrow muscles. So he went underneath the eyebrow, found the muscle, and attached it to the eyelid. So now we don't need that piece of silicone anymore. It's the muscle itself, okay? So for people who have apraxia of eyelid opening, this might be the newest thing that is done to help them with opening the eyelids. But, again, there are pluses and minuses to surgery. I won't go into great detail. Irrespective of that, all 4 of the surgeries that I just showed today, those are our true techniques that we have available to help everyone with the droopiness of the eyelid. Again, and I think a take-home point that I want to recommend to everyone is if you have an element of droopiness, these surgeries may be an option for you. If you are heavily dependent on Botox, Xeomin, to actually get you to the point at which you don't have spasms, these surgeries may limit how much you need on a 3-month basis because you are helping raise the eyelids. And more importantly, you are giving yourself an improvement in quality of life. Thank you so much. I hope this was enjoyable.